Hello, my name is Dr. Bert O'Neill. I'm an associate professor at the UNC Lineberger Comprehensive Cancer Center and a medical oncologist and cancer researcher, and I'm here today to talk to you about esophageal cancer. The esophagus is the tube that connects your mouth and your stomach. It has muscles around it that help propel food, and esophageal cancer can form anywhere in that tube, although most commonly at the end closest to the stomach. Esophageal cancer is a relatively uncommon cancer, but one whose incidence has been rising over the last 20 or so years. There are two main types of esophageal cancer, and they have different risk factors associated with them. One type is called squamous cell cancer of the esophagus, and that refers to the way the cells look under the microscope, squamous meaning flat. Squamous cell cancers are typically caused by excess use of tobacco or alcohol. The other type of cancer is called adenocarcinoma. Adenocarcinomas are more likely to form right near the stomach or the place we call the gastroesophageal junction. Adenocarcinomas are more associated with reflux disease and often with obesity. Gastroesophageal reflux over a long period of time causes changes in the esophagus, which are called Barrett's esophagus. And people with Barrett's esophagus are at much higher risk of developing esophageal cancer than people who do not have Barrett's esophagus. Esophageal cancer is typically diagnosed because of symptoms, and the reason for that is that it's not common enough that screening is done for the disease. Those symptoms primarily are dysphagia or trouble swallowing. Some people can be diagnosed because of anemia, which implies blood loss from the GI tract. And occasionally we find these incidentally when people are being screened because of symptoms in their GI tract by upper endoscopy. Upper endoscopy is a camera that's inserted through the mouth to look at the esophagus and stomach and perhaps first portion of the intestine with a camera. And if you've been diagnosed with esophageal cancer, you've most likely had one of these procedures. At the time of upper endoscopy, a biopsy can be taken through a small port in the endoscope. That biopsy is examined under the microscope by a pathologist, and that is how we determine what the general type of esophageal cancer is. Again, is it squamous cancer or is it adenocarcinoma? Esophageal cancer is a cancer that is typically treated by teams of doctors. These can include surgeons, radiation oncologists, and medical oncologists. The type of treatment for your esophageal cancer will depend upon the stage of the cancer. Stage is a way of saying what is the extent of the cancer or how advanced is the cancer. And we determine stage using a number of tests. The principal components of stage are the depth of invasion of the cancer through the wall of the esophagus, whether local lymph nodes are involved, and lastly, whether organs or lymph nodes away from the esophagus are involved. The tests that are used to determine these things can include endoscopic ultrasound. This is where a special endoscope is used that has an ultrasound probe at the end that can be placed in the esophagus near the tumor and can use ultrasound to determine how far the cancer has advanced in the wall of the esophagus. Some patients with esophageal cancer will need to have bronchoscopy because the esophagus travels next to the trachea or air tube. Some patients may have involvement of the trachea by their esophageal cancer. Most patients with esophageal cancer will also need some form of X-ray imaging Most commonly these days that would be a PET scan, but a CT scan might also be done at some centers. Esophageal is staged on a 1 to 4 scale. Stage 1 meaning early stage disease where the cancer is completely confined to the esophagus and has not penetrated the wall of the esophagus. Stage 2 typically meaning that the cancer has penetrated the wall of the esophagus but has not spread elsewhere. Stage 3 implies lymph node spread, and stage 4 implies distant or metastatic spread. If you've been diagnosed with stage 1 esophageal cancer, it is most likely that your treatment will involve only surgery. Surgery can be difficult for patients with esophageal cancer because of the location of the esophagus. This surgery often involves taking out a portion of the esophagus and moving the stomach from the abdomen up into the chest. This means a couple of things. One, it means that the surgery itself can be fairly dangerous. It requires incisions both in the upper part of the body and the abdomen. Some centers can do these surgeries either laparoscopically or robotically, although that is still not considered standard at most institutions. Secondly, this means that there is a relatively high chance of complications. And lastly, it means that you would need to get used to eating again after this surgery, because it's difficult for many patients to get used to the fact that their stomach is higher in their body after surgery. And nutrition is often a problem after surgery that needs to be dealt with carefully. That said, if you have stage 1 esophageal cancer, the results of surgery are very good, meaning that the chance of the cancer being cured with surgery alone is relatively high. If you have stage 2 esophageal cancer, there may be several possibilities for how your cancer would be treated, and these will depend on several factors. The first factor is how high or low in the esophagus is the tumor. Tumors that are very high in the esophagus are difficult to treat surgically and may instead be treated with combinations of chemotherapy and radiation. Stage 2 tumors that are lower in the esophagus may be treated with surgery alone, or depending on other factors that your physicians would discuss with you, may be treated with combinations of treatments including surgery, chemotherapy, and radiation. It is most common when radiation and chemotherapy are necessary to give these prior to surgery, or what we call neoadjuvant chemoradiation. This would typically involve about 5 weeks of radiation therapy, usually with weekly or less frequent chemotherapy during the radiation treatments. Radiation treatments happen on a daily basis, although they're typically quite short. Most patients get 5 weeks of radiation Monday through Friday, and typically will get their chemotherapy every Monday during that course. Some patients with stage 2 esophageal cancer will be treated with chemotherapy and radiation alone, and that therapy actually has a similar chance of curing the disease as does surgical therapy. Surgical therapy is difficult because of the location of the esophagus. When a patient has esophageal cancer and has to have a portion of their esophagus removed, typically that means their stomach has to be moved into their chest, that incisions have to be made both in the chest and abdomen, and this results in a relatively difficult recovery and often nutritional issues that need to be paid careful attention to. In fact, a visit with a nutritionist is almost a necessity for patients being treated for esophageal cancer. If your doctor has told you you have stage 3 esophageal cancer, this means that the cancer is either locally advanced or has spread to local or regional lymph nodes. The treatment for stage 3 esophageal cancer is very similar to the treatment for stage 2 esophageal cancer, meaning that most patients will require combinations of treatments, including chemotherapy, radiation, and surgery. Our preference is to give chemotherapy and radiation at the same time, usually followed by surgery after recovery from radiation. If your doctors have told you you have stage 4 esophageal cancer, it means they've found evidence that the cancer has spread outside the esophagus and the regional lymph nodes to other areas of your body, such as the liver, lymph nodes far away from the esophagus, or elsewhere, such as the lungs or bones. Stage 4 esophageal cancer is difficult to treat and is rarely cured. As such, our goals of treatment are different than they are for stage 2 or 3 esophageal cancer. Our goals in treating stage 4 esophageal cancer are to prolong life and to try to minimize the symptoms caused by the cancer itself. Many patients with stage 4 esophageal cancer also have problems with swallowing and nutrition. Sometimes those problems can be dealt with by chemotherapy alone, which is the principal treatment for stage 4 esophageal cancer. But some patients may need other types of interventions to help them eat better. Those might include things called stents, which are metal devices that can be placed in the esophagus to prop it open so that food can pass. Sometimes lasers are used via endoscopy to open up the esophagus, often in conjunction with stents. Or some patients may have tubes placed through the skin into the stomach or upper part of the intestine to help maintain their nutrition, and we call those feeding tubes. Occasionally, patients with stage 4 esophageal cancer will undergo radiation therapy. A few patients undergo surgery for esophageal cancer because the recovery for esophageal surgery is so long that most often the cancer elsewhere in the body would have progressed before the patient can recover from surgery. Chemotherapy, again, is the main treatment used to accomplish our goals in stage 4 cancer. The chemotherapy drugs that can be used are several. These are often used in combination of 2 or even 3 chemotherapy drugs at the same time, and your doctor will discuss the specifics of those chemotherapy treatments. A fraction of patients with esophageal cancer may also be treated with something called targeted or biologic therapy. A drug called trastuzumab is used for patients whose cancers overexpress a protein called HER2, which is also overexpressed commonly in breast cancer. You should ask your physician if your tumor has been tested for HER2 to see if HER2-based therapy would be added to chemotherapy. It's important to understand that HER2-based therapy by itself cannot be used for esophageal cancer, but can help chemotherapy to better attack the tumor in this case. Esophageal cancer is a disease that involves treatment by several different groups of doctors. As such, it's important that you ask a lot of questions of your doctors about what types of treatments you should be getting and what your options are. For example, based on your stage, it would be important to ask your doctor, am I a candidate for surgery? Do I need to receive radiation prior to surgery? Or even for some patients, should I be treated with radiation and chemotherapy and not be treated with surgery, as some patients are probably best treated with radiation and chemotherapy alone. It's also very important to ask questions about your nutrition and how that will be maintained during your treatment. For example, should you have a feeding tube placed, early on in your therapies so that your nutrition can be maintained during radiation therapy and surgery. And it is important to ask to be referred to a nutritionist sometime very early on in your treatment course with this disease. A diagnosis of esophageal cancer can represent a very difficult road for many patients in terms of treatment and recovery. Guideposts of Strength can be a resource for you both to better understand your disease and to help you find mentors or other people who have been through what you're going through who can help make your journey an easier one.